prevention. Hi, everybody. So please pardon my reading from the notes here. I'm going to try to actually get through 20 slides. So, I'm Larry Swiader. I'm the Senior Director of Digital Media at the National Campaign to Prevent Teen and Unplanned Pregnancy, and I'm delighted to be here to give you a really quick tour of the Bedsider Birth Control Support Network. So I was asked recently by the great museum thinker Mike Edson this question at a conference we did together. That question and my answer, which you can guess was a resounding no, frames my talk today. Bedsider was created to address the significant problem in the United States with unplanned pregnancy. 7 in 10 pregnancies are unplanned among women aged 18 to 29. And that's the case even though that most people think that pregnancies should be planned, and that most people think that it's important for them to avoid pregnancies in their life right now. But among those having sex and trying not to get pregnant, still 19% are using no contraception at all, and 24% use it inconsistently. So the intentions are not matching the behavior. And with this as the situation, the national campaign set out in the late summer of 2008 to look closely at the reasons that people weren't getting their birth control right, so we could reduce the number of unplanned pregnancies. What were the reasons for the failure? And so we started our research by taking a look at what was out there. And the state of sexual health and behavior change, as you can see, is not very pretty. What does any of this have to do with sex? The answer is not very much at all. And I always ask, why do the people with vaginitis look so happy? And so with Bedsider, we've tried to address the real issues and hurdles that women face at every stage of taking their birth control, and give them tools that can really use to stick with their plan not to get pregnant before they're ready. Part of it's education for sure, but it's education in a tone that makes sense and from the point of view of the women we're speaking to. Here's the Bedsider homepage. You can see at the bottom a link to the real stories where you can compare methods of birth control by watching videos of real women telling both the good and the bad aspects of birth control use. So you're able to choose a method by identifying with a real person, not a medical object. But speaking of medical objects, we've got those too. Our goal here was to demystify the objects. You know, what does an implant look like? Most people don't really know. But knowing that we can't be all things to all people, the Method Explorer is shared via an RSS feed that allows partners to add their own branding and customize it for a local audience. You know, Tim O'Reilly said, "A platform beats an application anytime." And that's what we want Bedsider to be, because it's the only way to meet our goals. And here you see that same Method Explorer on a partner's website called beforeplay.org in Colorado. And here's how it looks on another website. And here's the view of that same Method Explorer on our mobile website. Here's our Where to Get It section, which is a comprehensive clinic lookup for reproductive health, representing a number of national data sets. And we're adding to it constantly. And here's how it looks again on the beforeplay.org website. If you scroll down that page, you see the Bedsider, the Powered by Bedsider logo with some branding from the Colorado State Department of Health at the bottom. And here's an example of our fact or fiction videos. These animations tackle popular myths like, you can't get pregnant if you have sex during your period, or you can't get pregnant if you have sex in a hot tub.
Or if you're raped.
I give an extra 30 seconds for that, right? So I like to say create once and produce everywhere. So these videos are also found on YouTube, on many college TV stations, running as PSAs. There are Navy ships, and on MTV's site, It's Your Sex Life, and distributed by DVD to many health centers. Here it is on It's Your Sex Life on MTV.com. Here's a widget that we've created to discover whether you qualify for free birth control that's running on many other websites. Now I'll finish here with maybe the ultimate in sharing. This is our work with the Ad Council. Through our partnership, TV, radio, print, and web outlets have donated their time and space for our ads. And the results so far has been over $2 million worth of nationwide exposure. Actually, that's in the first quarter of this year only. Here's one of the print ads This poster does a great job of reflecting the values of the Bedsider program. But does it work? The truth is we don't know yet. Over the next 2 years, we're investing in placing emphasis on understanding Bedsider's effects by running a 1-year-long randomized controlled trial. And early results from a pilot that we did 2 years ago in Florida were very, very good. And since the November 10th launch of Bedsider, we've had over 2 million visits. But the bottom line is we approach all the content we create with an eye towards sharing to support the entire reproductive health community, so that in the end, it doesn't matter who completes our mission, only that it's completed. Thank you.